A very good evening to all of you. Today we are going to do radiology. Radiology is a very important subject. About 10 questions come from radiology in the NEET PG. So, even some of the questions in surgery are radiological. Some questions in medicine are also radiological. So, mastery in this subject will take you to the next level in your NEET PG. So, let's begin with the first question. Which of the following is most likely diagnosis of the patient with the following chest X-ray? A. TGA, B. TA, PBC, C. TOP, D. Epstein anomaly. Here you can see a boot-shaped heart, and this boot-shaped heart is seen in tetralogy of Fallot. So the correct answer here is C. Tetralogy of Fallot. Now let's move to the next question. Which sign is seen on USG when the femoral vein meets the great saphenous vein and femoral artery at the saphenofemoral junction? It is the Mickey Mouse sign. It represents the normal anatomy of common femoral artery, common femoral vein, and great saphenous vein on ultrasound at the level just inferior to inguinal crease. Radiation dose monitoring in occupation of a person is done by A. Linear accelerator, B. TLD batch, C. Gamma camera, D. GM counter. It is TLD batch. Remote afterloading dose is used in A. Brachytherapy, B. Electron beam therapy, C. Proton beam therapy, D. Cyberneb therapy. It is brachytherapy. Identify the given X-ray abnormality. A. Costochondritis, B. Cervical rib, C. Rib fracture second, third. It is cervical rib. In which of the lung pathology MRI is preferred over CT? A. Pulmonary embolism, B. Tuberculosis, C. Pancreas tumor, D. Pleural effusion. It is pancreas tumor. DSA angiography image is shown. What is the diagnosis? A. Pseudoaneurysm of ICA, B. Angiofibroma tumor blush, C. Multiple hemangiomas, carotid cavern fistula. It is pseudoaneurysm of retinal carotid. Which gives a negative test on FDG PET? A. Small cell carcinoma, large cell neuroendocrine, typical carcinoid, atypical carcinoid. It is typical carcinoid which gives negative test on FDG PET. Investigation of choice for detection and characterization of interstitial lung disease, MRI, chest X-ray, high resolution CT scan. It is ventilation perfusion scan. So correct answer here is high resolution CT scan. High resolution CT scan thorax is the best mode of investigation to diagnose interstitial lung disease. A lung biopsy is required if the clinical history and imaging are not clearly suggestive of specific diagnosis or malignancy cannot be ruled out. What is the probable diagnosis here? A. Thymoma, B. Mature teratoma, C. Aortic dissection, D. Lymphoma. It is thymoma. A middle-aged male patient presents with fever and diarrhea for 1 week, acute onset pain abdomen for hours, and a rectal X-ray was taken as shown. What is the probable diagnosis? A. Appendicitis, B. Perforation peritonitis, C. Toxemia colon pneumatosis. It is toxemia colon. In coarctation of aorta, rib notching is seen in A. Third to ninth rib, B. First to seventh rib. It is third to ninth rib. 20-year-old male presented with knee pain on movement and X-ray shows lytic lesion on upper end of tibia. Identify the lesion. Tibia giant cell tumor. It is tibia giant cell tumor. Juliet view of X-ray is for A. Pelvis, B. Calcaneum, C. Scaphoid, D. Spine. D. Pelvis. Puff of smoke appearance. If puff of smoke appearance in the question, directly click to moya disease. Fast, it is focused assessment with sonography for trauma. A. Which of the following gland tumor produces hot spot on technetium-99 per TechNet scan? Adenolymphoma, adenoid cystoid carcinoma, adenocarcinoma, pleomorphic adenoma. It is adenolymphoma. Investigation of choice for leptomeningeal carcinomatosis is A. PET, SPECT, gadolinium enhanced MRI, CT scan. It is GD enhanced MRI. Which of the following is used to differentiate between epidermal cyst and arachnoid cyst? A. Contrast enhancement, T1MR sequence, DW1MR sequence, DD1MR sequence. Which artery is resected most commonly following arteriography of the femoral root? A. Celiac trunk, superior mesenteric artery, inferior mesenteric artery, gastrointestinal, inferior mesenteric artery. Radiation exposure released in the following procedure: A. Micturating cystourethrogram, B. IVP bilateral nephrostomogram, primicity first one. It is micturating cystourethrogram. Frontal sinus can be best visualized by a Caldwell's view, Waters view, Towner's view, Schuller's view. It is Caldwell's view. Cerebral PET flow in an asphyxiated child is best measured by NIRS, PET, radionuclide imaging, MRI angiography. It is NIRS. Agon's side appearance is seen in A. TOF, B. TA, PVC, C. Uncorrected TGA, truncositis, uncorrected TGA. An absolute contraindication of MRI is A. Pacemaker, B. Prosthetic cardiac valve, C. Insulin pump. It is pacemaker. Hampton hump is a feature of pulmonary tuberculosis, pulmonary embolism, pulmonary hemorrhage. It is pulmonary embolism. Most sensitive sonological indicator of aneuploidy is gestational sac volume, coronary implant, mutual translucency, serum beta acid, mutual translucency. Gold standard for diagnosis of osteoporosis is it is dual energy X-ray absorptiometry. Maximum permissible radiation dose in pregnancy 0.5 rad, 1 rad, 1.5, 3 rad. It is 0.5 rad.